as we continue on in patient assessment, we're going to get to the third part of patient assessment, and that is history taking. History taking is arguably one of the most important things that you're going to do in your patient assessment. And so, we have a couple of acronyms to help you remember what questions you should ask when you're taking patient history. The two acronyms that we use regularly are SAMPLE and OPQRST. All right. What does the S mean in SAMPLE?
Signs and symptoms.
Signs and symptoms. Let's talk about signs and symptoms for a minute. What's the difference between a sign and a symptom? What is a sign?
Something you can see.
Something you can see or something you can measure. Can you see blood pressure?
No.
No, but you can measure it, right? So, a sign is something you can see or measure. That makes a sign, by definition, objective. Right? So a sign is objective. What then is a symptom?
Something that the patient tells you.
Yeah, a symptom is something that's reported to you. Does the patient have to be the one to tell you about it?
No.
No. Who else could tell you about it?
Family member.
Family member, bystander. The patient was complaining of chest pain before they collapsed. Is that a sign or a symptom?
Symptom.
Be a symptom.
It's a symptom because it's reported to you. Even though it's not being reported to you by the patient, it's being reported to you. So a symptom is something that is reported to you. Okay, by definition, because this isn't something you can measure, what is this?
Subjective.
Subjective. This will become important when we learn how to write patient care reports because we're going to use what we call a SOAP format. Okay? SOAP format is subjective, objective, assessment, and plan. Okay? All right. So signs and symptoms. What kind of questions are we going to ask to talk to our patient about signs and symptoms? What kind of questions are we going to ask?
Where does it hurt?
Where does it hurt? What else?
What happened?
What happened? What else?
When did it happen?
Okay. When did it happen? Why did it happen? How did it happen? Who, what, when, where, why?
How?
How? Okay. When we're asking our patient questions about signs and symptoms, we really want to ask them open-ended questions so that we can gather as much information as possible. Okay? What is the A?
Allergies.
Allergies. What do we want to know if they're allergic to?
Any medicines?
Anything.
Well,
If we show up on a patient who's having difficulty breathing and they have a peanut allergy, is that important?
yes.
Hell yeah.
Right? What if we show up to a patient who's in a field and they've got a bee allergy? Is it important that we know that they have an allergy to bees?
Yes, because they could have gotten stung.
Yeah, that allergy could be the reason that they've gotten stung. Or not the reason that they've gotten stung, but a sting could be the reason that they're having difficulty breathing. Right? Okay, so do we care if it's just medications?
No.
No, we want to know about everything. Do I care if they have a lactose intolerance? Not unless it means they're going to shat in the back of my ambulance. Okay? But it likely doesn't have anything to do with what's going on.
Yeah.
Fair enough? All right, what is the M?
Medications.
Medications. What kind of medications are we talking about?
Prescribed. Medications that they may have been taking, or maybe one that they took recently that they had an allergic reaction to.
Okay.
So they're
So it could be prescribed medications. What other medications?
over the counter
OTC medications. What else?
drugs.
Street drugs. What else? Alcohol.
Is that considered a medication?
It's considered a drug. Do I want to know if my patient has been drinking?
Yeah.
Darn tootin', I want to know if my patient has been drinking. Is that going to affect how I assess them? Yeah, it is. So I want to know about that. What else might I want to know about? Do they smoke? Do they vape? Are those things that might be contributing factors to the fact that they're having a problem breathing?
Yes.
Yeah. Do I want to know about them? When was the last time you smoked pot? We're in Oregon. When was the last time you smoked pot? About 30 minutes ago. Is that something I need to know?
Yes.
Yep.
Yes, it is. Is it going to change the assessment of my patient? Yes, it is. Is it going to change the treatment of my patient?
Possibly.
Possibly is a really good answer. When might it change the treatment of my patient?
Because they may just be, I don't know.
What if they have overdosed on opioids? What do we use if they overdose on opioids, Chief?
Narcan.
Narcan. So, if they tell me that they did some heroin and then all of a sudden they're unconscious on the ground, guess what? I'm getting that Narcan out. Bam.
Just be careful.
They'll come up swinging. It happens fast. Happens fast.
Have you ever done it?
Once.
Yes. It's freaky.
Once. And it happens fast.
They were as blue as a set of blue jeans. We thought they were dead. We're doing CPR, we're doing bag valve mask, we're doing all that stuff.
Here.
Paramedic came in and went, boink! And he sat up and he swore at us.
No, I mean like what? What? Where? Like.
Tell a war story.
Wilder, Parma?
No, Parma.
Okay.
Yeah.
That makes more sense.
We didn't get to a point of doing CPR, but he was talking, not making any sense, but he was talking and then he was out. And then he was up and talking again. Okay, what's the P?
Pertinent past medical history.
Pertinent history. If you are showing up to a patient with chest pain, do you think you want to know if they've had a heart attack before?
Yes.
I want to know if they've had a heart attack before. Do I care if they stubbed their toe 2 days ago?
No.
Not applicable.
Not applicable, which is why we're worried about their pertinent history. Why are you making noises?
I'm concentrating. That's how I concentrate.
All right. What's the L?
Last oral intake.
Last oral intake. Why do we care what their last oral intake was?
They may be dehydrated, or they may not have eaten in a long time, or they may have swallowed something that is causing their
Distress. Or we might be the last person who gets to talk to them while they are still alert and oriented enough to tell us when the last time they ate was. Then they're getting rushed into surgery, and do you think that the surgeon or the anesthesiologist wants to know when the last time they had anything to eat or drink was?
Yes.
Yeah.
Yeah, have you ever had surgery? Do they tell you not to eat or drink after a certain point in time?
Yes.
Yep. Why?
Because they don't want you to get sick while you're under anesthetic.
They don't want you to vomit while you're under anesthesia and then inhale all your vomitus into your lungs.
Vomitus.
Vomitus, yeah.
I don't know what it
It's a good word.
I like that word.
Yeah, I was
Vomitus.
going to say, I did not know that was a word. It's pretty.
But it's not as good as putrefaction.
It is not as good as putrefaction.
You said something completely different than he did.
I like putrefaction too. Okay.
Putrefaction.
What is the E?
Events
Events
leading
leading
up
up
to
to.
injury or illness.
Okay, what does that mean? Events leading up to.
What happened before this? Or
What were
happened
you
to
doing
cause
when this started? Oh, you're having chest pain and you were out mowing the lawn? That's really, really good to know. Oh, you're having chest pain and you were just sitting on the couch? That's really, really good to know too. Do you think there's a difference, excuse me, between someone who's having chest pain as a result of mowing the lawn, someone who's having chest pain while they're sitting on the couch?
Yes.
Okay.
Do you think there's a difference? I think there's a difference. One of them could possibly be angina. Right? What causes angina, Chief?
This is chest pains due to somebody who's overtaxing their circulatory system, and
So they're like
They need the-
overworking themselves?
They're overworking their heart, and their heart isn't getting enough oxygen as a result. Do you think the person who's sitting on the couch watching television was overtaxing their heart?
Yes.
If they were watching the presidential debates or yelling at the TV, that's entirely possible, right? Could happen. It's hard work watching Harry Potter, Mom, I swear.
It is, I'm telling you.
All right, what does the O mean?
Onset.
Onset. And what do we mean by onset?
When did this start happening?
When did it start? Do you think that events leading up to an onset tie into each other?
Yes.
Yup. If you think that they do, you'd be right. Ding, ding, ding. Good job, folks. Okay, what is the P?
It's his turn.
Provocation.
Provocation. Good. Provocation. It also can mean palliation. What is provocation?
What brought it on?
What provoked it?
What makes it worse?
Oh, what makes it worse?
What makes it worse? What provoked it? What provokes it? What makes it worse? Okay? If provocation means what makes it worse, what is palliation?
What makes it better?
What makes it better? Has anything that you've done made it worse or better? You took 3 nitroglycerin before we got here and it's no better? Get your butt in my ambulance and let's get out of here. What is Q?
Quality.
Quality. What is quality?
Describe your pain.
Describe your pain. Tell me how it feels. It feels like an elephant is sitting on my chest. Don't lead them though. Don't say, did something step on you? Does it feel like there's a knife in your side? Is it burning? Don't say that. Ask them to explain to you how it feels. What does this feel like? What is R?
Region and radiation.
Region and radiation. What does that mean?
Where does it hurt at?
Okay, where does it hurt at and where does it go? This is particularly important in the abdominal area, right? If you have pain in one quadrant and it travels to one place, it's indicative of a spleen injury. If you have a pain in another quadrant and it travels elsewhere, that's indicative of appendicitis. Okay? So, the region is where? Can you point to where it hurts at? Yes, it hurts right here. Does that pain travel anywhere? Does it radiate anywhere? Does it move up into your arm or into your jaw or into your shoulder? I have chest pain, okay? Does that pain go anywhere? Yes, it goes up into my jaw and I can feel it in my left shoulder. Shit, you're having a heart attack.
No, you don't say that.
You're not going to tell them that. But your brain's going to go, I recognize those symptoms. But you're not going to recognize those symptoms unless you know what questions to ask. Okay? What is the S?
Severity.
Severity. What is severity?
How bad does it hurt?
Yeah, on a 1 to 10 scale. You've all been to the doctor. You all know the 1 to 10 scale. On a scale of 1 to 10, with 1 being no pain and 10 being the worst pain you've ever felt, can you please tell me what this is? It's a 12. No, that's not even in the scale. Try again. With 1 being normal breathing and 10 being not able to breathe at all, what would you rate your difficulty breathing right now? Can you use this scale for more than pain? Yeah, I just proved to you that you could. Okay? All right. And then what's the T?
Timing.
Timing. And what does that mean?
How long? have you been hurting?
When did it happen?
We already talked about when it started.
Onset.
Onset. So
How
what is
long?
timing? Timing is how long has it been going on, or does it come and go? Is this a constant pain? Does it stay? Does it come in waves? Does it come in bursts? Tell me a little bit more about the pain itself. Okay. You're going to ask all these questions if your patient is conscious and alert, or at least semi-alert, right? What are you going to do if your patient isn't?
Then you're gonna switch over to your trauma assessment again.
This is part of our trauma assessment. Our history taking is part of our trauma assessment. What are we going to do if we can't ask our patient these questions?
Ask someone else who may know.
Ask someone else. Who?
Family members?
Or bystander.
Bystanders?
Or a
Family
caregiver.
members? What?
Or a caregiver.
Or a caregiver? What else could we do?
Look to see if they're wearing a medical alert.
See if they're wearing
members.
medical alert jewelry. Do you guys know people who should be wearing medical alert jewelry? I do. What else can you check? What else can you check?
Your driver's license is gonna show you organ donor, but not necessarily any other condition.
Your driver's license will, or their driver's license may show if they're an organ donor or not. Okay? Is that important to know? Did you know that if you call StateCom for a person who is deceased and they are an organ donor, that StateCom will make the appropriate arrangements to get the harvest team to the hospital that you're taking your patient to?
That sounds really bad.
Pardon?
I said that sounds really bad.
Actually,
A
don't be
harvest
surprised if
team?
they tell you to start doing resuscitative efforts so
They
that
will.
they can
They'll
keep,
make you do resuscitative efforts while you get your patient to the hospital.
Just to keep the heart
keep those organs.
working.
Just to keep
Viable.
the organs oxygenated. Okay, so this is history taking. History taking consists of sample and OPQRST. All right? Go ahead and shut that off.